Hello, good afternoon to everyone. I'm Dr. Sanjay Gupta. I'm an orthopedic surgeon. I head the Department of Orthopedics and Joint Replacement in Max Vaishali Hospital, which is situated in Delhi. And just a brief introduction of myself. I've done my training from India, postgraduate training from India, as well as higher training from abroad from UK. I've done MCH and FRCS in orthopedics from UK, and I happen to have special interest in doing complex primaries, knee and hip arthroplasty surgeries, and would also like to tell that to date I have an experience of doing near about 10,000 joint replacement surgeries, which have all been, by the grace of God, very, very successful. So if we talk about the success rate of the surgery, with the advancement in technology and the implant designs, the success of the surgery in our medical terms, as we call it, the survival rate of the implants have improved significantly. It used to be, the implant survival used to be about a decade ago. We used to say that the implant survival is about, 10 to 15 years. Now we have been saying that the implant survival is close to 20 years and sometimes even longer than 20 years. So one can be very, very assured that the current technology and the current implants that we are using in the joint replacement surgeries are going to give a long-term good results to the patients. These patients who have joint disease or the arthritic disease of the joints generally present with symptoms such as stiffness, swelling, and not being able to ambulate, not being able to walk. Though of advanced stage, some of the patients come and present with, not being able to walk even a few steps. And soon as the surgery is done, soon as the recovery happens, all this, though they persist for a period of time, I won't deny the stiffness, pain do persist for a small period of time. But once the patients recover from the joint replacement surgery, all the symptoms disappear like magic. You won't have any pain, you won't have any stiffness, you would be able to move around, you would be able to exercise yourself, you would be able to do most activities of the life that a normal person of your age would do, in daily routine. If we talk about risks and complications involved in joint replacement surgery, as we all know that no surgical intervention goes without taking into account risks or complications. As far as joint replacement surgery are concerned, there are 2 or 3 major risk factors that one is worried about. One is catching an infection. The chances though are very, very less, but even then, the quoted figure is about 1 out of 100, 1% or less than 1%. And the other potential risk in joint replacement surgery is getting clots in the legs, called as deep vein thrombosis. Sometimes these clots can go into the lungs and can cause a major complication such as pulmonary embolism, wherein patients can have breathing difficulties and major, life-threatening complication. But having said that, most advanced centers are taking due precautions in order to avoid these complications, and the chances of complication with passage of time are again, becoming less and less. One of the other complications that we are worried about in elderly patients especially is urinary tract infection, and now the technologies have changed. We are no longer using indwelling Foley's catheters, indwelling drains and all, and hence the chances of these complications have also become very, very less. Then chances of having any damage to the nerve or blood vessels are there. Theoretically, one can say the chances of complications are still there, but generally they are avoided. See, risk of not having the surgery is about, compromising your quality of life. A joint which is arthritic is degenerated, compromises your mobility, and you are in constant pain. If the degeneration in the joint and it's a progressive disease, it doesn't get better with time. So if one is apprehensive, one is skeptical, not undergoing knee replacement surgery or hip replacement surgery in an advanced stage, then the person is going to have a very, very compromised life, won't be able to move around. And a lot of these patients, they become so crippled that because it's a progressive disease, they become so crippled that, they they become bedbound. So it's not in the best interest of the patient. Along with a reduction in mobility, the body systems also take a hit and get affected. So it's a downhill course for the patients, for the people who have advanced disease and they decide not to undergo surgery. If a patient is safe to undergo surgery from anesthesia point of view, then it's a very smooth, very easy recovery for the patients, and I would recommend that they should undergo the surgery and reap out the benefits of the surgery, which is living and leading a very healthy, very good lifestyle without pain. The type of implants that we are using in joint replacement surgery nowadays are of very, very advanced design and material technology. Most of the implants that I use are, the companies which are multinational companies. If you were to name the companies such as Johnson & Johnson, Zimmer, Stryker, Smith & Nephew, these implants have got a very, very good record for last 30-40 years. Their survival rates are very, very good and, giving us a very good result. So we use the best of the best implants with the best of the best technology. A lot of these surgeries are being done with robotic technology, which is giving a faster recuperation, pain-free recovery to the patients, and better results and better long-term survival. Anything that a person won't be able to do the surgery, the answer is, broadly no. Most activities of daily life can easily be done after a person has undergone any joint replacement surgery, be it hip replacement, be it knee replacement, or be it, any other joint replacement. Yes, there are certain things that one should avoid after a joint replacement surgery. For example, if you have undergone a hip or a knee replacement surgery, we generally recommend that deep squatting and sitting cross-legged are two things that one should generally avoid, because, they can hamper the long-term survival of the implants. And in today's lifestyle, today's day and age, I don't think these activities are mandatory for a person to be done. Apart from this, there is no restriction. One can walk around, one can go up and down the stairs, one can do gymming, one can do cycling, one can do swimming, and one can also undertake light sports as well, for example playing golf and things like that. So majorly speaking, there are no major restrictions after having undergone a joint replacement surgery. If the osteoarthritis of the patient is at early stage, as well as if the patient is of relatively younger age, then yes, there are certain alternatives to joint replacement surgery. And amongst those, if I want to, grade them in the impact factor as to what works most, so the number one is, reducing the additional weight, the additional pounds that one is carrying on his or her body. So reducing weight is a very important measure that would decrease, that would alleviate the need for a joint replacement surgery, as well as alleviate the symptoms of the patient. And then comes the role of exercises. Keeping your musculature, keeping your ligaments around the joint strong is always helpful, always helps, because it reduces the load that goes onto your cartilages and helps in alleviating the symptoms, helps in deferring the onset, the progression of the disease. And then there are medications as well, there are medications which help to regenerate the cartilage to a certain degree. Not 100%, but yes, certain to a certain limit, the cartilage can be regenerated with the help of, or the damage of the cartilage can be deferred. Physiotherapy again is a very important tool which helps in treating the diseases when the disease is in early stage. So these are the things that one can adopt. And then lifestyle modification. Lifestyle modification is also very important. You know that you have tendency to catch osteoarthritis because a lot of these patients have tendency to have the disease which runs in the families. So if you know that you are predisposed to osteoarthritis, it is running in your family, your parents, your elder brothers, sisters are having the disease, you must be very cautious, very careful in the type of activities that you are doing. For example, sitting on very low surfaces is something which one should avoid. Too much of stairs, climbing and coming down the stairs. If you know that you have osteoarthritis and it is running in your families, then I think those activities should be avoided, as well as high impact activities, for example contact sports and all, should be avoided. Well, if you talk about having to undergo a revision surgery after primary joint replacement surgery, then the answer is yes. Survival of an implant, a knee replacement implant or a hip replacement implant, they are all mechanical joints. Despite the fact that the technology is improved a lot, the material of the joint is highly advanced. The longevity as compared to the previous time has certainly improved. The longevity, the survival of the implants is now close to 20 years, which used to be 10 to 15 years, 25 years, for example, hip replacement surgery, and even knee replacement surgeries are lasting for more than 20 years. So yes, if a person is of very young age, let's say, around 50, around mid 40s or 50s, then there are good chances that a person will have to undergo a joint replacement surgery in future. That would also depend on the type of activities that a person, how active the person is. A more active person, more chances of having to undergo a revision surgery in future. A less active person, kind of sedentary lifestyle person, less chances of having to undergo a revision joint replacement surgery in future. Patients who are in their in their 70s, in their 60s, generally the implant lasts for a very long period of time, and they are the ones who generally do not have to undergo a revision joint replacement surgery in future. Well, there is the good news for all the patients who want to undergo joint replacement surgery. Let me tell you, there is no restriction as far as diet is concerned. So one can continue with their dietary habits as they were doing prior to joint replacement surgeries, but certainly one has to be very careful in terms of what they eat. It has to be a healthy, a balanced diet. Activities, I think we have spoken about activities, so there is no major restriction in terms of activities as to what can be done and what cannot be done. So no major restrictions overall following a joint replacement surgery. Rather, after having the surgery done, your lifestyle improves. You become more active, you are able to do more exercises, you are able to shed off weight, so your agility improves. So I think this is a very rewarding technological boom to the human kind with the advancement in technology. So whoever is in need should undergo a joint replacement surgery so long as there are no major contraindications with regards to the anesthesia, with regards to the general health of the patient. Well, I'd like to tell you about a very good case study. There was a patient, a lady, a very lovely lady from Nigeria. She came to me with very crooked legs. Almost both her knees were bent to about 45 degrees, which is a huge deformity. So she had windswept deformity in her knees. Windswept deformity is like as if someone's legs are swayed away by a gush of wind. So one leg is going in one direction, the other leg is going in another direction. So if this is her body, her legs were like that. So she had very crooked deformities, and obviously she was bed bound. But over and above, the complicating factor was that she was Jehovah's Witness. I'm sure people know that they won't accept blood transfusion or any form of blood products transfusion even if they were to die. So they're very rigid about it. It's something to do with their religion. So I was faced with this challenge because operating on an elderly lady, she was 75 plus with crooked deformities. Such kind of cases more often than not would require blood transfusion after the surgery. So the challenge for us was to do the surgery, make her better, as well as not do any blood transfusion. So we had to do a lot of strategic planning as to how we proceed with the surgery. The surgery was going to be a complex surgery, a constrained type of knee implants which provides mobility as well as stability to the knee joint. So that was done. Surgeries were done in stages. First stage and then second stage. Within a span of about 7 days, both surgeries were done. But what we did is, in order to avoid blood transfusion, the blood that comes out from the patient's knee in the collecting drain that is used post-surgery was retransfused to the patient with the help of a special retransfusion bag that was imported from Switzerland. So that bag was retransfusion cell saver bag was imported from Switzerland. All the blood that was coming out from the patient's knee was collected in that, filtered, and was transfused back to the patient. So she underwent both surgeries in a staged way within a span of 7 days, and I felt so happy, and the lines that were used by her daughter, that Dr. Gupta, you have blessed. Patient's name was Blessing. Let me tell the name of the patient. Her name was Blessing. So she said, you have blessed my blessing with the walk of life. This is what she said to her. And that was very, very gratifying for me, very, very satisfying for me. So this was one of the special cases. We happened to do a lot of, such kind of complex cases wherein, patients have very crooked legs, very crooked deformities. But along with that, not being able to give a blood transfusion was the challenge in this case. Also, dear friends, let me tell you that I've had a great experience of working with this our medical partner, Gomedii. All the patients that have been facilitated by them have been very happy, not only with my treatment with them, and I would seriously recommend that if you have any issues with regards to your joint problems, then please do get in touch. If you want to reach me, you please get in touch with our medical partner, which is Gomedii. Thank you.